you think is suitable for you. So we'll start with this unit regarding the principles, values, and regulation in health and social care. That's what we are doing. The third learning objective is understanding the principles and values that are there for the provision of care, that underpin the provision of care. So within this, your objectives will be to describe the underpinning principles. What are the principles that are there in health and social care? Outline how these principles impact the provision of care, and explain initiatives to promote the fundamental principles among those working in health and social care. Assess how underlying principles support basic human rights, and to assess the implications when you fail to adhere to fundamental principles of care. So there are many organizations that fail to adhere. What happens to those? What are the implications? So sometimes the implications might be really severe, and sometimes they might not be that severe. So it depends upon what's been done actually. So when we start with principles and values that underpin the provision of care, so the values, you see them in a number of ways. So when you care for people, it's really important that you have respect, dignity, and you maintain confidentiality, impartiality. You're including them. So it's an inclusion. It's a way of including them. I'll come back to this, actually. Individual rights and responsibilities. So you need to ensure that your own values and principles do not interfere with the delivery of care. Here I'm talking about inclusion. Anyone amongst you three, hello, good morning. Can anyone tell me what do I mean by inclusion and by impartiality? Anyone there?
By inclusion, it means like in the decision-making process, the patient or the people we're caring for should be part of that process. Decisions and certain obligations shouldn't be carried out without them being part of it and agreeing to it. Then impartiality is like treating all patients equally in their own right and respects. And also, okay. Yeah, I think that's what I understand it to be.
Yeah, thank you. Anyone else? Thank you so much. What do we mean by inclusion and impartiality? So inclusion means, like it says, that you need to ensure that your own values and principles are not interfering with the level of, with the delivery of care. So you might have certain values, let's say I'm a doctor. I'm just giving my example. And my values, my religious values should always be different. They should be separate. They should not interfere with what I'm delivering as care. So if I'm treating a male patient or I'm treating a female patient, I should do it without any partiality. So there should be impartiality in that. That is what impartiality, and that is what means to put them in the right place, put them in the first place. That is being patient-centered. So if like I have my boundaries, everyone has their boundaries, obviously. The patient themselves have their boundaries also. So that is why whenever you are interacting with the patient, you're always asking for consent. Even before entering that patient's area, wherever they're sitting, you need to ask for consent. You need to ask if they would want a chaperone, for instance, if you're doing something, if you're having a sensitive talk with them, or if you're dealing with an examination process, for instance. So an impartiality is that regardless of race, gender, ethnicity, you're going to give as much care to each patient or each client of yours that you would give to the other one. So, and by inclusion, what I mean, so the terms respect, dignity, confidentiality, they're quite clear, but these two I just wanted to focus on. So inclusion, by inclusion, I mean that if I'm giving them a treatment option, they should be included in their treatment plans, their whatever, like if there's a follow-up, I can ask them if they're okay with that. So I have my limitations. For instance, if I'm not working on a weekend and weekends are easier for them, I might book them up with someone else who works on weekends. So I'm not going beyond something that I cannot do, which obviously it cannot happen. But then I'm making the best I can do for them, just to include their opinions, their comfort, their preferences in whatever care is being given to them. I hope that's clear. So with principles and values that underpin the provision of care, you have 6 values here. So there's commitment to quality of care. So you're committing that you will give quality of care. Whatever you're doing, it should be of the best quality. So because of this, you will have obviously benchmark trainings, you will have continuous professional development for your own self. There'll be improvement in the services because of that. There should be compassion. So if you deal with someone without compassion, even if you're giving that quality of care, it doesn't matter. So these go hand in hand. Improving lives. So your main objective is, or your main value is to improve lives. Working together for people. So that's not the responsibility of only one person. It cannot be the responsibility of one person. That is why we have teams. And everyone counts. So you count as well as the others count. So it is important to make them aware that, yes, you have a say, but then there's others also that have a say. Respect and dignity. So if you have these values within yourself when you're treating or you're dealing with your clients, it becomes an integral part of your services. Then the objective is to describe the underpinning principles of health and social care. So what are the underpinning principles of care? So that is to protect vulnerable service users from mistreatment and improve their quality of life. Caregivers must follow the Principles of Care Act 2014. What do I mean by vulnerable service users? Anyone? Who would you name as vulnerable?
I think people that are classified under the vulnerable category are people that are disabled or physically challenged, age, people of elderly and children. I think pregnant women as well. Then I think sex as well, sex of the person.
Okay, that's fine. Thank you. Anyone else? Anyone else? I need this class to be really inclusive. That is why I keep asking if anyone else can answer the question as well.
Yeah, I think like you said, vulnerable service user could be people that generally cannot really help themselves on their own. So you're not classified looking at the age, so at the children, the elderly, the disabled.
Yeah, so those are vulnerable people basically. So what you do with them, obviously, you would be providing them extra support, and you're not mistreating them because they have. So let's say there's a person who's vulnerable. For instance, the person has dementia. So they're vulnerable, isn't it? Dealing with a dementia patient, obviously, you would know better than me that it's quite hard. They're vulnerable, and it's quite hard to deal with such patients. You tend to not treat them with the same, in the same way as you would treat someone who does not suffer from this problem. But this should not be the case. You should be able to treat, or you should make preferences to treat them in the same way that you would treat the others who are not vulnerable. So if there's one patient who's vulnerable or more than one, you're always going to give your 100% there. The principles aim to emphasize that everyone in care. So what are we talking about? The Care Act 2014. So everyone in care is a human being with wants and needs. So every want and every need would not be the same. Please remember. And they define how important it is to involve a service user in the process of assessing their safeguarding needs. Safeguarding is a very important issue that comes into play. Can everyone please mute themselves? Okay, so the next thing, we'll talk about is, just a minute, I'll start rotating this. Okay, so the Principles of Care Act, what are they? 2014. So it encourages caregivers to take a person-centered approach. This person-centered approach is very important when you're safeguarding vulnerable adults. Again, keep it person-centered, keep their care around them so that they are a part of their care. When you follow the principles, you too place the vulnerable person's well-being and needs at the forefront of safeguarding processes. So always remember, these people need support, they need dignity, just in the same way as you would do it for anyone else. Just remember, this is your duty. Even if there's no one watching you, if you have this inbuilt in you, you will be able to do what you have to do for every single patient, regardless of whatever their status is. But when there's a vulnerable person, you're taking extra cautions regarding their safeguarding, regarding their the way you're approaching them. So it should be patient-centered in every case. However, when it's a vulnerable adult that you're dealing with, you'll be extra cautious while doing this. So they help you directly involve the vulnerable person. So what's a person-centered approach? So you're directly involving that person and any nominated people who can help reach decisions in the vulnerable adult's best interests when you're managing safeguarding concerns and care plans. So what could be safeguarding issues in a vulnerable adult, if I ask any one of you?
Neglecting the person when you're supposed to deliver care.
Mm-hmm. Yes. So that probably that person might have a risk of falls, or let's say there's a bedridden patient who is vulnerable, and they have safeguarding issues also. So how is it that you would protect them from different aspects, like they might not have to face a fall, or they might not have to face a bed sores, for instance. So you're keeping a more cautious eye on them when you're talking about vulnerable adults. And then the 6 principles of the Care Act 2014. So that's empowerment, empowering them. So when you're doing it person-centered, it will be empowering them in the decisions. Protection, prevention, which we've just talked about, just make sure that you're preventing any risk from happening. Proportionality, partnership, and accountability. So what's proportionality here, if anyone could tell me? You understand partnership is obviously having a partnership with them, so they're more empowered, and you're accountable for whatever you're doing. What do I mean by proportionality? Anyone? Okay, when I don't get answers, that means I go ahead and answer the question myself. That's okay. So when we are explaining these terms, so the empowerment principles, remember these are principles we are talking about in the CARE Act 2014. So the empowerment principle would encourage you to support vulnerable adults so they can confidently make their own decisions and give informed consent regarding their care. So they've been informed of their care and they give consent based on that information that has been given to them. And they're making their own decisions. So you're empowering them. So this will be to a certain extent, not that if there's something that's harmful for them, they're not allowed to do that. You're obviously going to draw a line there. And then protection says that the aim to provide service users with clear, simple information about how to recognize signs of abuse and when to come to you for help. This is all about vulnerable adults. Prevention is to follow the preventive principle, so you must be proactive to stop safeguarding issues or concerns from developing in the first place. So safeguarding issues, you should be aware of all of them. So you're going to prevent any such safeguarding issues that could arise in their care. Proportionality is to make your safeguarding processes proportionate, involving the vulnerable adult when making decisions. They can give you input on what the actions in their mind have the least impact on their quality of life. So this is again you're giving them authority. You're giving them you're involving them when you're making decisions, but they can they can talk whatever they want to. Because they're vulnerable, you will have that thing in mind that their care has to be transparent. So its accountability will be transparency. So you're taking responsibility for the safeguarding practices. However, they have a decision in whatever you're making, for whatever decision you're making for them. So they can speak out their minds to you. And then partnership would be, you should partner with your local services and communities to help prevent, detect, and report suspected cases of neglect and abuse. When multiple authorities recognize a safeguarding issue and submit a report, authorities can react quickly and confidently. So you're working in partnership with the patient or with the client, as well as the other authorities that are involved in safeguarding. So here there's some other points also to remember. So there's the dignity agenda. So dignity in care policy. The aim of this policy is to achieve highest standards of patient dignity and to place the patient's experience high on everyone's agenda. So whatever the patient has as feedback, that should be on everyone's agenda. So if they've given a negative feedback, for instance, we're going to work on that negative feedback to make it positive by any means. So we'll go to any extent to make it positive. The policy provides a framework and standards for improving the experience of patients in all areas of the trust, talking about NHS trust. And then the duty of care, you not only have a duty of care to individuals who you are caring for and supporting, but also to other workers. So there might be doctors, nurses, healthcare support workers, caterers, cleaners, maintenance workers, all of them are responsible for each other's care and for their support. So if you can support them in any way, whilst you're doing your duty, that is always a plus point. Safeguarding means protecting a citizen's health, well-being, and human rights. So by health, obviously, you mean that they should be kept healthy. If they're ill, it's a road towards health that you would be wanting to achieve for them. Their well-being, so it's not only health, it's mental well-being also, physical well-being also, and their rights should be respected. So this enables them to live free from harm, abuse, and neglect, because these vulnerable adults, or whoever it is who's vulnerable, Even apart from vulnerability, there are safeguarding issues for people who are not even vulnerable. So for instance, children are always vulnerable, isn't it? So there should be no harm, no abuse, and no neglect in regards to children. So always have these things in mind, because when you are giving care to patients, you should be assessing these concerns, and you should be liaising with other authorities to come into action. This is for the protection of vulnerable people around you. So it is an integral part of providing high quality care. Safeguarding children, young people, and adults is a collective responsibility. And then comes ethics. So healthcare ethics would refer to a set of moral values. So whatever you're doing, you have to have moral values that are there to guide you. And they're the principles that are used for decision making in the field of medicine. So confidentiality, code of conduct, for instance. So what impact do these principles have on the provision of care? So you have these 6 principles of safeguarding. So you're protecting people, you're going and working in partnerships. So when you, for instance, just make this bigger. So when you're providing protection, so when the workers, when working in an individual's best interest, so you're protecting them from harm, you're ensuring that they are protected from harm as much as possible. Continue to include the person in decision-making processes. Not all abuse is a crime, but where there is a, wherever you find there is a crime happening, or wherever there is an abuse happening, seek support from the police that's there 24/7 with you. Then we work in partnership. So when you're intervening to protect a person who lacks capacity, to ensure a multi-agency approach. So probably you do not have the authority to do something, but there are other organizations that can look into it and work with you. Accountability in a multi-agency approach, the local authority will ensure that each agency knows who is responsible and for what. So you're accountable for whatever you are doing, but then there are other people also around who are accountable for their actions. So that your aim should be transparency in interagency policies and protocols. Then comes proportionate care. So here you see you have this as being equal. So make sure those with capacity are in control of their lives. When a person does not have capacity, work in their best interests and identify interventions that respects rights and freedoms. So there might be a person who doesn't have a capacity, and that should not go against their care, their best provision of care. And then we are preventing, like we support the person to safeguard themselves. So we give them actions to follow, we educate them, we give them choices and opportunities, we raise awareness of abuse and rights to speak up. Last comes up empowerment, which obviously means that you're giving them capacity and you're giving them supporting and helping them in making their decisions, which makes them empowered. So some impacts, so what impact does this have on the provision of care, these principles? So some examples are, so on the quality and safety of care, so you're ensuring that the right services are offered and that they are of good quality whilst considering paramount safety of the service user. And then you're supporting for rights of individuals. So every individual has the right to make decisions based on whatever they feel is right for them. However, it should be in their best interest. This is for you to be aware of and take charge for that. So having the right support given by the most appropriate services is to be referred to the most appropriate services if it's required. So if there's a mental health issue, you would be referring them there. If there's a bereavement issue, you would be referring them to bereavement services or any specialized treatment, whichever is required. This is only when you have the care principles obviously in mind. So this is how it will impact your provision of care when you have the Care Act or the core principles of care in mind. Consistency and coordination of care. So this there should be, like, if you're giving your best once, it should be your best always, and they're coordinated in every way. So you're ensuring consistency throughout the care process. So if there, it's also an impact is there would be an impact when there's failure to comply to the provision of care. So how could that happen? What would result in that? There will be poor quality care. There will be infringement of rights. So the patient has rights. You should be aware of them. If those are not given to them or they are deprived of them, obviously the care quality goes low. And then there are safeguarding issues. If you're not complying to provision of care according to the principles that we've just mentioned, and striking off by professional bodies. This is also a possibility that the whole organizations might be shut down. So, so there are positive impacts on of provision of care. So there could be fast access to reliable health services or health advisors. There could be effective treatment delivered by trusted professionals. And then there could be continuity of care and smooth transitions. This is all when you're caring for the patient and adhering to the core principles. Involvement and in decisions and respect for preferences, alternative or attention to physical and environmental needs, which is very important, emotional support and respect, involvement and support for family and careers, and this is to what extent the patient wants this. So if they don't want family to be involved, their decision would be respected at all times. Clear, comprehensible information and support for self-care. So not every patient will understand what care is being given to them or what care plan is being made. They need to be made aware of what is being planned for them. The third aspect of this learning objective involves explaining initiatives to promote fundamental principles among those working in health and social care. So there are many initiatives within the UK that promote the fundamental principles of care within the health and social care sector. So these are UK Dignity Agenda, promotion of rights, patient-centered care, the 6 Ps of care. So UK Dignity Agenda, what is that? In recent years, there's been an importance of the dignity in care agenda because this has been neglected for a very long time in other countries specifically. So, and it's increased within the health and social care context. So within the NHS Trust, there was this ULH hospitals they're committed to ensuring that all patients and their families, carers are treated with dignity and respect throughout their journey. So this is their agenda that they have shared. So you put an agenda like this throughout the care journey. So you're involving all the families, the carers, and the patients in this journey, and committing to ensure that they've been treated with dignity and respect throughout the journey. So dignity care is everyone's business, obviously. So whether it's engaged in direct patient care, working in one of many supportive roles within the organization, each employee must understand the impact of their words and actions upon the qualitative patient experience. So what does a patient, what is this? Can anyone tell me what is this? What does this mean? Why am I showing this to you? Anyone? Does this make sense?
No, I don't know. I don't know. I've not seen it before.
So it's talking about 82% of Britons support assisted dying. What is assisted dying?
I think it's relating to patients or people in end of life rather than
Yes,
prolonging any form of suffering, it could help facilitate the quick passing away.
yes, with ease. So it's
Yeah,
at the
yeah.
moment it's not legal within the country. It's called euthanasia actually. Okay, euthanasia is taking one's life by themselves. That is obviously assisted, but then there's a patient, a physician assisted suicide also. It's called a physician assisted suicide, where a physician supports removal of care or removal of life support when that patient is obviously is in a debilitated condition and wants to pass away in peace. You do not prolong life, uh, and you change laws. So this is just a depiction of what is this. So sorry, we'll come back to this. So this is what the picture is about, and you'll see mostly people who are vulnerable, who are adults, who want quality instead of quantity. They're okay with however they've lived their lives. They just want a peaceful transition from this life to the other life. So whether they're engaged in direct patient care or working in one of the many supportive roles within the organization, each employee must understand the impact of their words and their actions. So this is giving dignity, providing dignity to everyone. So you're giving dignity to their rights also, not just putting them aside that, oh, they don't understand what it means and how important their lives are. No, they know more than you would. But if this is their decision, you would have to support their decision in every way. So we are explaining the initiatives to promote the fundamental principles among those working in health and social care. So dignity in care policy. The aim of policy is to achieve high standards of patient dignity and to place the patient experience high on everyone's agenda. So the policy provides a framework. This policy, dignity in care policy, provides a framework. You could have a look at it. This is there in your Moodle documents. So it sets standards for improving the experience of patients in all areas of the trust. And then their principles or this policy articulates clearly that every employee will uphold values and behaviors to the highest standards in relation to dignity in care. And these will include to put the patient and the public at the center of your work, and we will treat patients, colleagues, and visitors with respect, dignity, and empathy. So this policy also has sections that relate to service provision and building design, education and training, gender accommodation, care provision, advocacy, and advice. So you can have a look at this document whenever you have the time. So then we talk about promotion of rights. So the NHS follows the Human Rights Act and promotes each individual's rights. So each individual has 15 basic rights according to the UK human rights. So they have a right to life. They have a right not to be tortured or treated in an inhuman or degrading way. The right to be free from slavery or forced labor, the right to liberty and security, the right to a fair trial, the right to no punishment without law, the right to respect for private and family life, home and correspondence, the right to freedom of thought, conscience, and religion, the right to freedom of expression, the right to freedom of assembly and association, the right to marry and finding a family, the right not to be discriminated against in relation to the enjoyment of any of the rights contained in the European Convention, the right to peaceful enjoyment of possessions, the right to education, and the right to free election. So these are the 15 basic human rights that the NHS follows and promotes. Then there's patient-centered care. So when we have the patient-centered care, you honor their choices. This care improves quality of life, empowers the residents, enhances dignity, promotes positive well-being, and supports independence. So whenever you're doing it patient-centered, these are all the values that go higher. And then you have the 6 C's, which is very famous, the 6 C's of person-centered care. You have care, you have compassion, you have competency. So you have to be competent in their care. You have to have compassion. If you're not competent enough, obviously the care goes down. Patient-centered care goes down. Communication should be the best. It should be transparent. You should have the courage and the commitment. And then how we assess how the underlying principles support basic human rights. How do you think these principles support basic human rights? Can anyone tell me? We are approaching towards the last set of slides. Anyone? So we talked about the 15 basic human rights, and we've talked about these principles of care. Can anyone tell me how would they support these human rights that we just spoken about? Anyone?
Hello.
Yeah, I'm listening.
I would think the 6 C's are embedded into the 15 human right qualities, because if you care, if you show compassion, if you are competent, if you communicate adequately, show courage and commitment, it means you are following the guide and the actual thought process in the human rights principles. Because for you to show compassion, it means you are respecting dignity, you're inclusive, and for you to show communication, it means their rights and their freedom of speech or to be heard is being followed as well, because your communication is in 2 ways. You're telling them and you're also listening to them. That's how I can relate both sections.
Yeah, thank you. Thank you for that. That's a good explanation. Anyone else? Does anyone else have any idea? Any comments? Okay, so yeah, so just as you said clearly that when you talk about the 6 C's and you've talked about the basic human rights, so obviously when you're caring for their rights, you're caring for whatever their human rights are, you're giving the best of care. This is when you achieve the goals. And there should be compassion. So whatever decisions they make, that should be accepted with compassion. So if there's compassion, the decisions would be accepted, obviously, and they'll make sense to you then. And there's some things that need courage, obviously. So like, for instance, this end of life treatment that we've talked about, this needs courage to bring it forth. And you have to have the courage. Communication should be the best, so that the patients, when they know through this communication what their rights are and to what extent they can exercise their rights. So yeah, thank you for that explanation. Then we assess how underlying principles support basic human rights. So the principles that are used in healthcare provide a set of clear ideologies for setting and evaluating health policy and service delivery. So when you're targeting discriminatory practices and unjust power relations that are at the heart of inequitable health outcomes. So you don't want this to happen. You want a fair trial. You want them to marry whoever they want to. Obviously, it should be within your cultural norms. But if it's not, it is said that you should be respecting their dignity and their decisions. If they're making if they're capable of making choices for themselves, they have the capacity, so their capacity has to be assessed. So you're assessing how underlying principles support basic human rights. So these support rights to respect, dignity, inclusion, impartiality, confidentiality, individuals' rights and responsibilities, which we've just addressed. So then you're assessing how underlying principles support basic human rights. So there are others also. So you're considering empowerment, protection, prevention, proportionality, partnership, and accountability. We've just talked about this. We've talked about safeguarding issues that may be there in vulnerable adults, equal access to care, whoever's there, regardless of race, gender, ethnicity, you're giving equal access to care to all. Overall, these underpinning principles and values ensure quality, access, and coordination of all service users. And when you fail to adhere to these fundamental rights, what happens? There's lack of quality. So there's breach of rights, human rights. There are accessibility issues when you don't consider these human rights. Or these principles of care. There could be serious injuries also. And then obviously your feedback, patient feedback, which matters the most, would go down, resulting in probably closure of the institute. So there'll be ill health of service users, inadequate services, miscoordination, missed appointments that result in lack of care for service users. There could be negligence where clinicians or carers may fail to conduct themselves in an appropriate manner, leading to failure to take appropriate care of their service users. There may be gross misconduct when someone causes harm through serious negligence and they're unable to perform at work due to alcohol or illegal drug use or commit a serious breach of health and safety regulations. So because this is everyone's responsibility, you need to make sure that it is your responsibility as well. So we've looked at today describing the underpinning principles of health and social care. We've outlined how these principles impact on provision of care. We've explained initiatives to promote the fundamental principles among those working in health and social care. We've assessed how underlying principles support basic human rights, and we've assessed the implications when you fail to adhere to these principles. That's it from my side. I'll just quickly go up and this opens up. Just have a look. Okay, no. So if you have a look, this document is there at in your Moodle site. Yeah, that's it from my side. I will stop recording. Any questions? Anyone have any questions?